In addition to having a perspective on the history of psychology, I think it's important to take a look at historical figures. Taking a look at these historical figures would give us a more realistic look into what it is to be human. Sometimes the greatest among us are not what we would consider normal. Let's take a look at a few of the stories behind the figures as we briefly explore historical figures and their psychological illnesses. We will start with Martin Luther King Jr. Martin Luther King was certainly a great person. He is quoted as having to have said, "We have to stop accepting what everyone else believes. We have to become maladjusted if we are to be creative. And then we may find that insoluble dilemmas are masks for unrecognized problems with simple solutions." This adult course of repeated brief depressive episodes which Martin Luther King had is consistent with the fact that the pre-adolescent King reacted impulsively to his grandmother's death, twice jumping out of a second-story window in an apparent suicide attempt. In his last year, he was deeply depressed, a personality change noted by dozens of friends. His New York-based physician Arthur Logan, who was very close to King at the time, recommended psychiatric treatment. King and his closest advisors considered Logan's advice, but decided that the King could not follow it. King's nonviolent resistance can be understood as a politics of radical empathy, an acceptance of one's enemies as part and parcel of advancing one's own agenda. The goal was not to defeat them, but to change their attitude. Racism was not a political problem to be outlawed. It was a psychological disease to be cured. Martin Luther King was certainly a great man, and we should all appreciate his contribution. Let's move on to the next person, and that would be Ludwig von Beethoven. Many of you remember Ludwig von Beethoven as being a great composer. He was also a pianist who had bipolar disorder, which some have said gave him such creative power that his compositions broke the mold for classical music forever. He was a child prodigy whom his father tried to exploit. His manic episodes seemed to fuel his creativity, and he wrote his most famous works during times of torment, loneliness, and while suffering psychotic delusions. It took him 12 years to finish his last and eighth symphony in total deafness. He then medicated himself with opium and alcohol and died several years later of liver disease. The next figure I would like to discuss is Abraham Lincoln, who suffered from severe depression. Abraham Lincoln was the 16th President of the United States, and he suffered from severe and debilitating depressions that sometimes led to suicidal thoughts. This was recorded by Carl Sandburg in his comprehensive 6-volume biographical analysis of Lincoln's life. Lincoln relied upon several means to cope with his depression, including work, humor, fatalistic resignation, and religious feelings. A tendency to be melancholy, Lincoln once wrote in a letter to a friend, "Let it be observed, is a misfortune, not a fault." The most amazing part of his story was the sheer determination with which he willed himself to overcome his serious affliction and still achieve all he was able to do for our young and troubled nation. The next person I want to talk about is Vincent van Gogh. Vincent van Gogh was a famous French painter and artist. He was characterized with peculiar and suffering from unstable moods for most of his short life. He suffered from epileptic seizures that some thought were caused by excesses of absinthe, which at the time was a very strong liquor popular among talented people such as himself. Many have tried to offer a definitive diagnosis of his illness after reading his personal letters. It is believed that his depressive states were also accompanied by manic episodes of enormous energy and great passion. The next person I'd like to discuss is Winston Churchill. Winston Churchill was Prime Minister of England during World War II. He was also an officer in the British Army, an historian, an impressionist painter, and a Nobel Prize winning writer. His memoirs describe his battles with depression, which he nicknamed his Black Dog. Accounts have also indicated that he may have suffered from bipolar disorder. Finally, a more contemporary individual is Billy Joel. Billy Joel is a six-time Grammy Award-winning rock musician, pianist, and singer-songwriter, the sixth best-selling recording artist in the United States. He was also inducted into the Rock and Roll Hall of Fame and the Songwriters Hall of Fame. Billy Joel battled many years with depression, and in 1970 left a suicide note and attempted to commit suicide by drinking furniture polish. He thought it tasted better than bleach. He received inpatient psychiatric care for depression after being rushed to the hospital by his drummer and placed on suicide watch. This episode became the lyrics to his song Tomorrow is Today. Billy Joel later recorded You're Only Human as a message to help prevent teen suicide. Joel nonetheless continued to have problems with depression and alcoholism. In 2002, he entered a substance abuse and psychiatric center, and in 2005, he checked into the Betty Ford Center and stayed there 30 days. So, what does it mean to be human? Human means that we are not perfect. Being human is about coping with the frailties and foibles of life. If there is a norm, then it should be more obvious. It is hoped that all who read this will understand that greatness is not without humanity. While the great individuals in life have gone before us, have done wondrous things, they are also human. We can aspire to be no more, and certainly no less.